morning, good afternoon, everybody. I'm Dr. Quang from the Chợ Hospital in Vietnam. Now, today, I would like to present to you the art topic, evaluate the result of the fixation procedure in the patient had the rib broken due to the chest trauma. As you know, the rib fracture is the one of the most in the blunt chest trauma, and the rate of complication increase with the number of the rib fracture. And we have the correlation between the number of the rib fracture and the intrathoracic injury. Now, another kind, the multi-rib fracture may be lead to the deformation of the chest wall or the flat chest. In the Vietnam, Chợ Hospital is the first place to perform this technique, and we want to evaluate the probability, safety, and capability of the technique. This is a retrospective from the November 2015 and the 9 to the September 2006 with the 33 patients. About our indication, the patient has the three rib fracture and with follow factor like that, the break six rib or the more continuously. There are two broken on the rib, loose spear, deformation of the chest wall, the flat chest, and the pain cannot control with the anesthetic. This is the deformation of the chest, and another side, this is the multi-rib fracture. The multi-rib fracture. This is a flat chest, and the last indication is the lung hernia to the rib fracture. All the patient has the CT scanner and the reconstruction with the 3D skeleton. We use the titanium plate and titanium screw. Usually we don't fix on the rib fracture, and we use the plate 8 hole and the 6 hole for the patient. This is our result. Near 1 year, we had 33 patients with the mean age is 34 years old. The concomitant lesion, another bone fracture is the most, and the second is the abdominal organ trauma. About the indication, we indication the rib fracture for the patient who has the 3 more rib fracture and the pain uncontrolled. Another side in the chest wall deformity and the flat chest. Usually we make the 3 rib for the patient. We fix the 3 rib for the patient. The mean time of operation is about 75 minutes. And another kind of the procedures like the chest frame, remove the blood clotting, or the suture the pull injury. We had a 4th case of the flat chest with the mean of the mechanical ventilation is about in the POD is about 36 hours. And the hospital admission day about 6 days. Some author tell that show that when we fix the rib for the patient who had the flat chest, the patient will have a few days on the mechanical ventilation, few days on the ICU, and a few days in the hospital. This is about the pain score of the patient. This is the red line, the pain score in the pre-operation, and the blue line is post-operation. We had a significant of the decrease the pain score in the patient who has the rib fixation. We had 2K of the complication, 1K of the infected wound, and 1K of the screw strangulation. No case of the mortality. This is some case on the right side. It is just one of the multi-rib fracture and the collapse the lung. This is after we repair, we fit the 3 rib for the patient and lung re-expand. And this is another case on the left side. This is a multi-rib fracture with the flat chest, and the patient has a multi-rib fracture and multi-point rib in one rib, and this location of the chest wall. After we put the we put the plating, we put another metal metal, titanium metal to recover the chest wound of the patient. And now is the conclusion. Refixation are necessary in the patient who has the flat chest wound deformity and the pain uncontrolled. The rate complication and the mortality is low. Maybe it affect to reduce the time of the mechanical ventilation, reduce the bench score, reduce the chest wound deformity, and stabilization the paradoxical movement in the flat chest. Thank you.